Um, Dr. Mustafa Nadeem Kirmani is an associate professor and the head of Amity Institute of Clinical Psychology, Amity University in Haryana. Um, he's uh, he's completed his MPhil from the esteemed NIMHANS in Bangalore, and his PhD in a very interesting area on health, happiness, and spirituality amongst adults from Aligarh Muslim University. He's been appointed by the Government of India Council RCI as a visiting expert for RCI regulated clinical psychology programs in the country and is a real subject matter expert in this area. He has several publications to his credit and has presented his work at national as well as international forums. And so I'd like to warmly welcome you, Dr. Kirmani, for today's meeting. And thank you for joining us today.
Thanks a lot, Dr. Jayashree. Thank you.
So I think let's just start with a very broad question that a lot of people have. I think, we've been hearing the word mental health a lot. It's something that's really become a buzzword in since the pandemic. I think things have picked up a lot more. What do we actually mean by mental health? Maybe you could help us understand this a bit better.
Yeah. So I would like to thank Dr. Jayashree and your Samvedna Care Institute for giving me the chance to talk about mental health, especially in the area of geriatric psychology. Mental health is an area which is often being ignored. So if someone wants to know whether he or she is mentally healthy, there are certain behavioral markers which we can understand. For example, if someone knows that about his or her strength, her potential about in any area, that can be an indicator of his or her good mental health. Number one. Number two, whether he or she is contributing something meaningfully for himself, for his family, or for the community at large, that can also be an indicator of mental health, good mental health. Third thing is, that if someone is able to face challenges of life, we all face challenges in life, challenges will come. So how, if someone is able to cope or faces the challenges of life effectively without having his life significantly impaired because of that challenge, if these things are being taken, are being followed by a person or people at large, we understand that he or she is overall mentally healthy. These are three markers. There are other factors that where self, you can observe yourself. For example, if someone feels that there is a desire to work, if someone wakes up in the morning and he or she feels, yes, I have to go to work, that is an indicator. If someone's hunger and appetite is okay and he's feeling hungry at times, at normal usual times, it means it is okay. He's mentally healthy also. And if someone's excretory system, digestive system is okay, he's urinating fine, his digestive system is fine, that is also an indicator that his mental health is fine. And about his sleep, if someone says, yeah, मैं सो जाता हूँ, मैं ठीक, मेरी रात को नींद ठीक आती है, so these are the broad indicators, behavioral markers, which tells us that our mental health is relatively okay, is fine. Yeah.
So there's you very interestingly brought out a relationship between physical health and mental health. It's
Yeah.
so kabhi the physical health aspects are also very important for this.
Yes.
Can you tell us a bit more about this? Because people seem to think mental health is only in the mind. Is there a relationship between the mind and the body, and what is
Yeah.
this relationship?
See human being. If we see our body, we are made up of our brain. Where the thought processes are there. We have emotions. We have behavior, and we have physiology. We have biology. So overall, human beings are psychosocial being. For example, if someone touches like this or pricks something, it's a physical thing. But it affects my mind. I may start crying. Oh, हटाओ इसको, बहुत दर्द हो रहा है. Okay, so it's a physiological thing, it's a biological thing, but it is affecting our mind. Okay, we cannot have a disconnect between our biology, our mind and body, so that is a very strong connection. If our mental health is impaired, definitely our physical health will also be impaired. And there are studies which have shown that people who have cardiovascular disorders, hypertension or diabetes, they have more chances of depression, because they interconnect. There is a connection between how we experience emotions, how we experience thought, whatever thought process we have, our actions, behaviors, and our biology. So there is a strong interconnect between our mind and body. Yeah.
Absolutely. I'd like to now just pause here and turn to the people who've joined us.
Yes.
Before we continue further, I would like to mention to everyone that we are recording this meeting and it will be available on our social media channels. And we welcome you to ask questions, share any sort of comments that you may have in the chat box. Um, you can do this anonymously, or there's an option to just send your question or the comment or concern that you may have directly to the host, and we'll be able to ask this anonymously as well. But I mean, maybe I could just ask this to everyone who's listening in. When we talk about mental health, I'm curious to know what is that one word that everyone associates with good mental health? What is it that what is it that when we generally think about mental health, what is that one word? And I encourage you to just type in your answers. What is it that
Yeah.
comes to your mind when you think about mental health? Iska kya matlab hai? What is that one word that comes to your mind? So whilst I think people are thinking and it's typing in their responses, and another thing that I think people often ask us is, why is mental health in older adults? Is it is it something that we need to think about separately, or is it the same as other age groups? Why are we talking today about mental health of older adults? So I can see a lot of responses coming in,
Yeah.
and maybe we'll turn back to this after we hear what Dr. Kirmani has to share.
Yeah.
What do you feel are the reasons? Is there a reason why we need to think specifically about mental health of older adults?
Mm-hmm. Is the question directed to me or for the
Yes,
audience?
sorry, I was going to ask. I was asking you, Dr. Kirmani. I think our audience has been sharing that these are the words
Okay,
that
okay.
come to their
So I
mind.
think
Hmm.
I know. Yeah. See, there has been a lot of myths, like when people become age, as they progress towards age, 40, 50, 60, there are a lot of stereotypes associated with aging. अरे अब तो बूढ़ा हो गया, अब तो, I mean, मन अच्छा नहीं, शरीर भी काम नहीं करता. Okay, so I think what is important is we need to inculcate a mindset that when someone is aging, it's actually he's or she's accumulating the life experiences. A lot of positive life experiences we all keep gathering, and we call that wisdom. Okay, and that wisdom experiences of life, I mean, can be used by the person who is towards the aging process, and can be used for himself or herself to guide others. That is one of the important concept that is emerging nowadays, how we use our positive life experiences to share with others, and how to channelize others. That is very, very important. And second thing is how we relate with others. Relationship, quality relationship is something which has a very important predictor of good mental health. If we are satisfied with in our relationship, okay, and if we say that I have a lot of friends and I can I can share many my issues with my friends, and they have good quality relationship. Okay, so that is a very strong predictor, and also a sort of a buffer which actually caters to the mental health, even physical health of people who are towards aging process. Okay. Yeah.
Yeah, no, absolutely. And thank you so much for throwing light on that. I think we've got a lot of responses from people who are listening in about what is that one word that they associate with mental health and
Yeah.
cheerfulness, emotional well-being, positivity, happiness, being content with oneself, awareness, compassion for less privileged, um, enthusiasm for life, self care, support, stigma, um, logically thinking, and being loving to everyone. So it seems to me from what people are saying in the audience as they're listening in is that there are many different aspects to feeling positive, different things that contribute towards mental well-being. And it's interesting that somebody has even mentioned, being aware, being compassionate.
Yeah.
So it almost seems like, the sense of gratitude is also something that contributes to mental well-being.
Oh yes, mental well-being is a combination of gamut of factors, and
Hmm.
I'm happy to see that a lot of audience are talking chat. I mean, the writing words which a science has shown. Research has shown. For example, someone is saying content with oneself. So contentment with oneself is very important factor for people who are self-satisfied. Self-care. When I say self-care, it means a person who is able to take care of oneself. It is also an indicator that you are going in the right direction in terms of health. Whether physical health or mental health. Logical thinking. Logical thinking. What you are able to think in a rational fashion, in a logical fashion, is also an indicator of your good mental health. And some side, very important thing, self-awareness. If you are aware about yourself, that I have this strength, I have these areas of limitations. So it is an indicator that you can further you can just share these strength or tell people about your strength, and use those strength for yourself and for others. So I think audience are well versed with the basic concept. We need to just sensitize them and make them more conscious that yes, you know about it. Yeah.
Absolutely. Right.
Very true.
And so we do have some questions that have come in. I'm just going to share one of the first
Sure,
ones.
sure.
Um, Someone has asked that they consider sleep and mental health as being related, and you mentioned this also. Um, um, but a lot of, and I think what this person has asked is about how to get good sleep without depending on medicines. Do you have any tips for this? And is it, how is this related with mental health and well-being?
Okay. See, sleep is an indicator of good physical and mental health. Okay. But it's about, we all are different. One person may need 5 hours of sleep, 6 hours of sleep, okay, or 3 hours of sleep. It depends upon one's biology or DNA or mindset. It determines a lot of factors. So we don't have, science does not have a formula कि आपको 5 घंटे सोना चाहिए. It depends from person to person. That is a basic thing we all need to understand. Now, if someone is having sleep disturbances, first we need to understand what could be the factors behind that. Nowadays, as we all know, that a lot of digital thing is there. A very commonsensical thing, if we are using the WhatsApp and engage ourselves in such programs, obviously our sleep will be disturbed. 12 बजे तक 1 बजे तक अगर आप डिजिटल मीडिया में एंगेज रखोगे तो आपकी स्लीप डिस्टर्ब होगा. व्हाई? बिकॉज आवर दिस डिजिटल थिंग इफेक्ट्स आवर ब्रेन. तो ब्रेन गेट स्टिमुलेटेड काफी देर तक, आपको पता नहीं लगता लेकिन नींद देर में आती है. ओके, तो वन थिंग दैट वी नीड टू अंडरस्टैंड इज व्हाट आर द आवर लाइफस्टाइल, हाउ वी आर स्पेंडिंग आवर लाइफस्टाइल, एंड वेदर मीन it is affecting our functioning. That is something which is very, very important. और रात को time is a very specific thing, very specific thing, plus differ to person. But as lifestyle balance रखना, जो आपका एक दिनचर्या चल रही है उसको बैलेंस आउट करना is something which is important. मतलब ये नहीं कि रात का आप 11 बजे अगर सोते हो तो 10 बजे खाना खा रहे हो, तो obviously physiology will change, and it will affect your sleep. So what I suggest is we need to introspect first what could be the factors which is affecting our sleep. So many of the solutions will come very quickly, and if still we are not able to get sleep, we might need to consult someone. Okay, so that is what I wanted to say. Okay, but person himself will decide whether you are okay, whether your sleep is okay or not, depending upon how one feels at morning.
I think we're experiencing a bit of a technical glitch. You could just give us a couple of seconds. I think Dr. Kirmani should be back soon. There seems to be some connectivity issue. Sorry, I think there seems to have been some connectivity issue. So apologies for that. But I think one of the things that Dr. Kirmani was mentioning was about how important it is for us to think about the kind of sleep that we're getting and what may be contributing to these problems. Now, another question that I see is what is the optimal amount of sleep that someone should have? As Dr. Kirmani was mentioning, this is something that may differ for people across for each individual. For older adults, it's very often sleep gets disturbed for various reasons. This could be something like having to get up multiple times to go to the bathroom. It could be because the need for that amount of sleep also reduces with age. If you are physically as active as you can be, if you maintain a routine, you may find that your sleep improves. One of the other things that I think is also really important is that to avoid daytime napping as much as possible, because it's a cumulative amount of sleep that the body requires. So if you are taking short naps, 15 minute ab so liya, fir khana kha ke you sleep for another half an hour, 1 hour, it may be that all that amount of sleep that adds up through the day is actually is enough, and you are therefore sleeping less at the night time. So try to avoid that. I see that we Dr. Kirmani's come back.
Yes, I'm back.
Great. I think we have another comment about sleeping in phases. Yes, sleeping and worrying a lot between when you between these phases. Dr. Kirmani, do you have some tips or some advice about how to improve one's mental health and how to kind of like, what are the signs to watch out for poor mental health, and what are some of the things that someone could do to improve their mental health and well-being?
Yeah. So see, one thing is, there are multiple things. I can suggest few things. For example, if your sleep is disturbed, I'm saying sleep because sleep, we were discussing about sleep. It could be an indicator. If you're not enthusiasm to work, if you feel most regularly that आज आई एम नॉट एबल टू, मन नहीं कर रहा जाने का काम पे, घर का काम करने का मन नहीं कर रहा है. Okay, so that may be an indicator. It's not just it happens in 1 day or 2 days, okay, but if it is happening consistently. Number 2. Number 3, if people are reporting to you that you have changed, for example, they may say आजकल तुमको गुस्सा बहुत आता है, you know, पहले नहीं आता था. Okay, sometimes people give the feedback. लोग कहते हैं आजकल तुम्हारा काम की प्रोडक्टिविटी खराब हो गई, पहले तो बहुत काम करते थे, आजकल घर में भी आपका इतना मन नहीं लगता, थोड़ा अलग अलग रहते हो. These are the indicators, behavioral indicators that people tell us. These are the things that we need to reflect why they are saying this, and we may need to think how we can take those feedbacks coming from people. Okay, so these are the possible indicators of area where mental health is deteriorating. Now there is a question how we can improve mental health. There are a lot of studies have been done in the area of positive psychology. They found that more you engage with people in terms of helping others. Okay, so that is one thing that you can improve mental health. लोगों की हेल्प करिए, जन सेवा जिसको हिंदी में बोलते हैं, इट्स वेरी वेरी इंपॉर्टेंट. नंबर 2, gratitude letters. You just think about your life and then imagine who are the people who have contributed significantly in your life where you are standing today because of XYZ factors. मेरी लाइफ में इस बंदे ने ये हेल्प किया था, इसलिए आज मैं यहाँ पर खड़ा हुआ हूँ. उसे तो gratitude is very very important. Third is forgiveness. You just learn how to undo the negative emotions that comes up when you feel traumatized because of something that happens. Try to learn the skill of forgiving others. It is difficult, it's a challenge, but if we practice, if we learn something, if we learn it from a trained professional, it will definitely help. So these are the important factors that are like a spark, that it put in a spark which can improve our mental health. Start feeling happy about ourselves, happiness. Yeah, small tips.
Wonderful. I think some very powerful things that you mentioned. Showing gratitude,
Yeah,
being forgiveness, and as you mentioned, these are difficult, but simplistic, but challenging as well. It's important
challenging.
that we
Yeah.
become aware of these things. Um, we have another question about the warning signs of dementia. Um, is this something that you could throw some light
Yeah.
on?
See, to the best of my understanding, I always give this example. Now, suppose I have a key,
Hmm.
and my grandpa or my grandma forgets where I put the key. It's okay, nothing to worry. मैं भी भूल जाता हूँ. We all forget. चाबी कहाँ रख दी? Many time it happens. But if someone with age, for example, as someone is asking, uh, in the context of aging, if someone has finding it difficult, what does it function? What is the function of the key? चाबी का काम क्या होता है? वो चाबी की जगह लगाने की जगह कहीं और he or she is putting up, then this is an indication that things are coming up. चाबी का भूल जाना इंपॉर्टेंट नहीं होता कहाँ रखी है. चाबी का काम क्या होता है ये भूल जाना, या इसका बारे में मालूम नहीं चाबी क्या काम करती है, is something that something that we need to think and what is happening in his mind. Number one. Number two, लोगों के नाम याद रखना. भाई आप मेरे बेटे हो, आप ये हो, इट्स ओके, भी हम नाम सब भूल जाते हैं. लेकिन इफ यू आर ऑब्जर्विंग दैट डे टू डे लोगों को आप अक्सर कंफ्यूज हो रहे हो, पीपल आर गेट कंफ्यूजिंग. आर यू माय सन?
Hmm.
Is he my son, my daughter, my wife? Okay, and लोग, people are, third thing is, जगह जाते हैं लेकिन अपने घर वापस नहीं आ पा रहे हैं. ये देख रहे हैं भाई आज मैं रास्ता भूल गया.
Hmm.
कॉमन जो रूट्स हैं वो भूल गए हैं, डिफिकल्टी हो रहा है वापस आने में जगह.
Hmm.
कॉमन जो वो 4 महीने पहले 6 महीने पहले नहीं होता था. These are the indicators, warning signs that we need to think and start thinking that we have to consult some professional, maybe a neurologist or clinical neuropsychologist, something like that.
Bilkul, bilkul. So these are the
Yeah,
very simple indicators
simple
about
indicators.
changes in day-to-day functioning, and if these happen consistently over a
Yeah,
period of time, iska frequency बढ़ता है, that's the time at which somebody should really seek help from
yeah,
some
yeah, yeah.
professional. Hmm. There's another question about what are the major psychological issues experienced by older adults?
Mm-hmm. Okay. No, psychological issues in the sense, if we have to see this thing from a clinical perspective, that is different. If we have to see it from non-clinical perspective, these are different. Now, a lot of things is happening. If you talk to older people, they often say, I mean, that people are not my family members are not engaged with me. They report. We take our trainees to a homeless population. Okay, so many times they say, मेरी आप सुनते नहीं हैं लोग. Okay, मेरे बच्चे मेरी नहीं सुनते. So they feel a sort of isolation, a psychological isolation, disengagement, or with others. So they feel that मेरी अब कोई value नहीं है. Okay, so these are the psychological issues that they often experience, and they often don't report. Our culture, our culture is collective culture, wherein people think that ठीक है, मैं बड़ा हो गया हूँ, बढ़ा गया हूँ, मेरी एज हो गई है, तो मेरे बच्चे ऐसे रखना चाहते हैं तो आई एम ओके. बट अंदर से वो फील अच्छा नहीं करते हैं. हमेशा चाहते हैं कि बच्चों के साथ एंगेज रहें, अपने ग्रांड किड के साथ रहें. So these are the issues that they often experience once they become old. Yeah.
और जैसे आपने कहा कि क्लिनिकल इश्यूज और साइकोलॉजिकल इश्यूज दोनों में फर्क है.
Yeah.
एक प्रोफेशनल के पास कब जाना चाहिए?
Professional के पास, as I said, as we discussed, that Alzheimer's or dementia, those are the indicators. If these are emerging, that definitely they should consult. Family members should consult. Okay, or they if people observe that वो अलग-अलग रहने लग गए हैं, they start feeling sad. आप देख रहे हैं कि वो बैठे-बैठे रोने लग जाते हैं. Okay, मेरी कोई चिंता नहीं करता है, मेरी कोई फिक्र नहीं करता है. If we are seeing crying spells, so these are the things that indicate that this person might need a professional help. So for depression, maybe depression is coming up. In that the earlier case, maybe dementia is coming up. So these are the very simple behavioral indicators which tells us that this person, my grandma, my family member, might need some professional consultation. Yeah.
And we have another question that's come in that says, do older adults benefit from counseling or therapy sessions?
Oh yeah. Yes. I think therapy session, counseling sessions, they have benefit. They definitely get benefit. There are a lot of studies, a lot of clinical work have shown that when they are engaged in therapy, they get benefit. Their symptoms improve, and their wellness improves. But I say that we need to develop a system in which the family members themselves become a so-called counselors. When I say counseling, in the sense, they know the basic skills how to engage with their parents, or how they help them engaging with kids. Okay, that is very, very important. And research does show that the older people get benefit from therapy and counseling.
So that's very important. And I think जिस चीज़ की आप बात कर रहे थे, that is how, in terms of communication, कि फैमिली में कैसे communicate करना चाहिए, वो भी बहुत important है. About problems, about challenges, about worries. That's also something that's very important. Sharing about your emotions, your feelings, your concerns.
Yes. And providing them a space to share is important.
Yes.
One more thing which I forgot is a concept of spirituality. It is coming up, and clinical work. If you ask a person that describe about your spiritual experiences or describe about your religion, they say that I go to practice my religious practice. And you ask, describe how do you experience, what do you experience, how do you feel after that? Most of the people say unko acha lagta hai. It means it is their experience. So we need to encourage people to engage in spiritual and religious exercises, whatever faith they may carry. But because research has also shown that more spiritual practices people are engaged in, better they feel about themselves, better they engage with others. They बोलते हैं अच्छा लगता है, अच्छा लगा.
Bilkul.
Yeah,
And that's an important thing that you mentioned, and I just want to reiterate that it's the experience, that if something is making you feel good, that's an
yeah,
indicator you should continue to do it. So
very
that's
true.
very, very important. I think there are several questions that have come in. Someone is mentioning that they get many warning signs of dementia only in their dreams. What should they do?
In the dreams, in the sense,
I think maybe I wonder if this is something that maybe anxiety about future sort of deterioration in health. Is there some sort of concern about that? Perhaps if someone has concerns about deteriorating health in the future, what can they do to help themselves?
I think if someone is what I have understood from the question is, if someone is having, I mean, like dreaming about this warning signs of dementia or Alzheimer, right?
Mm,
So first thing is they should discuss those warning signs with the family members. कि मेरे आज मुझे सपना ये आया. Okay.
mm,
So many times, there are a lot of research work in sleep. That is not my area of sleep thing. But if we engage them with the family members to discuss about dreams, sometimes even dreams related to Alzheimer related symptoms, so sometimes it is help soothe them. Okay, but we will also have to watch whether these symptoms are really emerging or not. Sometimes these symptoms, I mean, if they are worried too much about Alzheimer, dementia, okay, so dreams might come, but in real life they are not experiencing those symptoms.
mm.
Yeah.
And we have another question about how can families support um, elderly in their mental health?
Okay, I think there are very simple exercises. First thing is we need to engage family members, grandpa, grandma, okay, with kids. We need to talk to them. We need to talk to them about their contribution. For example, I talked to my father that dad, Pitaji, आपने I lot of I for a lot of gratitude. You have done so much for me. Okay, so when we talk about their contribution or their experiences, if we tell their stories, success stories, and guide us based on your experience of life, okay, it makes them feel good. That is, or spiritual exercise, as I said. So spiritual exercises, using their positive experiences, using their wisdom as a resource to help the family members to go ahead. These are very important factors. उनको लगता है, yes, my life is going on. My life experiences can help others, my own family members, my sons, my daughters, my grandchildren. So this is something which is very important. So that is how we can engage these people with the family members.
Wonderful.
Yeah,
And I think these are things that we all need to keep in mind and share as well.
yeah.
There's another comment about the role of caregiving and to elders and how challenging that is. I think maybe this is a comment. But is there something that family members who are caregivers of perhaps older of adults who have some sort of chronic condition, is there anything that they can do to take care of their mental health and well-being?
I think it is very important when one is engaged in caring the family member, and if it is continuous process, it is burdensome.
Mm,
Definitely it is burdensome. It causes a lot of distress. It causes a lot of burnout. So it is important to try to, I mean, engage all family members, whatever the family members are there. Because if someone is doing one thing continuously, obviously he or she will feel emotionally exhausted. So it is important to just share the responsibilities, so that the burden or worry or emotional exhaustion can be reduced.
mm,
And sometimes to disengage yourself with the caring role and
mm,
involve others in that role, that also helps. So disengaging oneself and helping others to share that role with the family members who's having some issues is something which is very important.
Absolutely. And so it's a really important to share that burden,
Yes,
and
yes.
ask for help.
Yeah.
Okay, I think there's another comment that uh, my father is complaining of pain and weakness in the body from past 2 months after a traumatic experience. Could this be psychological?
Mm-hmm.
Pain in the body and following some traumatic experience. Is this is there, does somebody experience physical pain in the body after some sort of traumatic experience, and
Oh,
can you
yes.
help them?
I give a very simple example. If I'm talking to the audience digitally,
Mm.
if a line comes, in front of me, I oh, you know, that is a very simple example that what happens in your mind, whatever we have perception about XYZ thing, it obviously affect our mind and our if in our body. If there is some traumatic experiences,
Mm.
those experiences continue to affect our physiology. So it's important if to explore what has happened in a non-judgmental fashion, and allowing the space, just
Mm.
listen to the story of trauma, and
Mm.
try to validate in the sense that I can understand you have undergone that thing without being judgmental. So
Yes.
that itself sometimes help, and from that process we come to know whether the trauma is so much that it might need professional help. It might go away with time. Nothing goes away with time. We need to
Mm.
engage ourselves with something, with some psychological thing which can help us to come out of trauma. That depends what is the extent of the trauma, how one has perceived the trauma. So these are the factors that can yes, that is definitely a thing. Trauma will directly affect your physiology.
So it's important to be aware of the
Oh,
impact that
yes.
it can have, and I think this is something for family members also to be aware of, and it's important to understand that, as you mentioned, time will not just take care of things by itself. It's important to do something actively. Maybe if there's a need, meet a professional. Um, unlike there's another comment that someone's mentioned. Unlike in Western countries, Indians don't consult psychiatrists or psychoanalysts. It's considered shameful. Like person who's suffering from depression or bipolar disorder, and they only consult without the knowledge of the family. And I think that's a very I think we were just discussing that, and how it's important
Yeah.
it is for everyone to really just spread this awareness. Let's break that stigma against seeking help for mental health related issues together. There's another question that's come saying that I'm a 47-year-old software consultant, very active, physically fine, and no sugar, etc. But notice that there are certain incidents of the past that can't remember. Um, and is this something to be worried about? If somebody is unable to recollect all instances of the past, or if there are certain memory lapses that they are noticing, is this something of concern?
Okay. So the answer is like, very simple. If we are not able to recollect something, okay, and if something is impairing your day-to-day functions, you want to recollect something and you are not able to do work at
Mm.
workplace, that is impairing your work. If you want to recollect something and you're not able to perform your day-to-day functions at home, okay, you want to recollect something but you are not able to attend, for example, a function, a family function, आप भूल गए, अरे यार याद ही नहीं रहा मुझे, okay. If these things are happening and affecting your daily activities of daily living or your overall functioning, that it may be an indicator that you just go and consult a professional. Not always that you will be 100% having this some problems, but it will when you consult someone with a professional, so it will help you to understand whether you really need further help or not. Okay, that is what I understand from these symptoms or experiences what a person is reporting here.
Mhm.
Consistency and affecting on daily life.
So basically, the if somebody is experiencing some sort of memory lapses, that what you're saying is that you should become worried or concerned about if it's beginning to impact your day-to-day functioning, either at work or when you're doing the routine things that you do at home. That's the time at which you really need to think about take this a little more seriously and probably meet a professional to get some sort of
Yeah,
evaluation done.
very true.
Great. Um, whilst we are just waiting for more questions to come in, I think there's one more thing that a lot of people ask, and I wanted to just understand from you. Do you feel that we're neglecting mental health of older adults as compared to other age groups?
Mm. Uh, to be very frank, I cannot answer this question from a base of research because I
Mm,
do not know about if there is some research done in this area, but many based on my observations, day-to-day observations, and my clinical understanding and clinical observations also. Sometimes, we taken for granted, like for example, that if someone is having memory issues and the memory issues are really significant, maybe going towards dementia diagnosis. So sometimes people take it for granted, thinking it age mein hui jata hai. You know,
mm,
I mean, I should not use this word, but I think when we are engaging the audience, वो culture का word इस्तेमाल करना जरूरी. बहुत से लोग बोलते हैं तो सठिया गए.
yeah.
This word is often used. So it's very common. Unless I use this word, people will not understand. So they think that it is very normal. I say, but sometimes it is not normal. It may be an onset of illness like dementia.
Yes,
Okay,
yes. Mm,
so I think sometimes it is ignored or people are not aware about such certain markers, behavioral markers of onset of illness in like dementia.
mm. So I think in general, it's difficult sometimes for people to understand what could be part of a natural aging process, what could be
Yeah.
onset of something like dementia, what could be just somebody who's feeling low. We all have ups and downs, or is this a sign of a mental health issue? And I think there is so it's I think that's maybe one of the more challenging things when we look at older adults, because a lot of this, as you were mentioning, कि culturally हम accept कर लेते हैं कि ये होता ही है, and that's
Hmm.
we need to be more aware of this.
Yeah, yeah.
So that's really really important, and I completely agree with you. Um, I'm aware we have a couple of more minutes left, and I just wanted to ask if anyone has any questions for Dr. Kirmani. Please do put them in the chat, and we can have Dr. Kirmani answer these questions. So there's one question asking about why do memory lapses happen?
Hmm. Okay. So there are multiple factors. So I think in this meeting, those gamut of models of memory we may not discuss,
Hmm.
but many people come the memory. Yesterday I was discussing something. So when we say memory has impaired memory, first we need to think whether memory has developed. Because
Hmm.
memory can only be impaired if something has gone into our head. I can give example like this. If a bottle, if I'm putting the water into the bottle, okay, only then I can take the water out from the bottle. If something has not gone, if water has not gone into the bottle, how can I expect water to come out? What I'm trying to say is, if attention has not been given, so attention is the first thing. आपको ध्यान देना होता है चीजों पे. जब वो स्टोर होती है, रजिस्टर होती है, उसके बाद आप उसमें से निकाल सकते हो, unless you put something in, how can it be out? So that also we have to understand whether attention was given or not. Okay, so that is a very simple thing that I try to explain people about memory.
So, I mean, absolutely, you can only remember what has gone into the memory in the first place, recollect
Yeah,
that. So I think that's something really, really important to also consider. And something as simple as not paying attention to what somebody else is saying when they're
yeah,
talking, it means you may forget what they have said. So that's something that we often happens. Uh,
yeah.
I think that there's another question that we had, which is coming about. What is there any relationship between depression and dementia?
Mm, depression and dementia. To
Sorry, I think we may be facing some network issues. Um, Maybe whilst Dr. Kirmani's connection stabilizes, I, j- I just like to ask everyone who's in the audience that if there's one message, if there is one message from what we've been discussing today that you could think about, or one take home learning that you could share with others to help um, spread awareness about mental health, mental well being, one tip that you think has been useful, what would that be? So I'd really like to hear from everyone who's listening in today. What would that one tip be that you could share with someone that you may have learned today, or that one thing that you feel uh, useful that you've heard today? Put this in the chat, and whilst you're thinking about that, I hope that Dr. Kimrani's network improves and
I'm back.
back.
Yeah.
Great, great. Wonderful. So I see some responses already coming in. The importance of maintaining communication, acknowledgement, gratitude.
Gratitude.
So sorry, Dr. Kimani, I think because of the connection, you were, in the middle of answering the question about your
Yeah,
relationship
yeah,
between depression and dementia.
yeah, yeah. So yeah, I was saying that based on my clinical hunch and clinical judgment, there could be a link between a person who has undergone depression and might lead to dementia at later age. But I have not gone through any research paper which supports this. Empirical evidence I don't have. Clinical experience, clinical judgment, I think if something affects your brain in the sense of depression, so it might predispose someone to become a client or patient of dementia. This is my clinical hunch. We need to just go through a research. What does the research say about it?
Yes, absolutely, and I think definitely you're absolutely right. There is dementia, depression is one of the contributory risk factors for
Yeah,
dementia, and definitely. So, if
true.
you have depression, it's important to manage it. It's important to treat it. So that your risk for dementia, developing dementia, reduces later on. So
Very true.
I think there are several risk factors for dementia that are modifiable risk factors. This includes even something like, um, uh, keeping your diabetes or hypertension under control. Diabetes and hypertension are very common um, lifestyle related issues, and it's important to
Yeah,
manage that well to reduce your risks for dementia. So I can see that some of our participants are sharing their thoughts on what they feel are useful takeaways to maintain
yeah,
good mental health and to promote mental well-being. And someone's mentioned that listening, being compassionate, empathetic, and all are also empowering. And I think that's also very, very important. There's another question about, is dementia hereditary? I mean, maybe if there are any, you could take this question, and I'd just like to check with everyone if they have any other questions that they'd like to ask. You could put this into the chat box.
Is dementia hereditary?
Hereditary. Yes, Dr. Kirmani, do you think
Mm-hmm.
is dementia hereditary?
I would, I mean, I would like to answer in this from how genes and environment functions. Okay, so it may or may not, because I know people who have undergone dementia, Alzheimer's, and there was no one in the family. Okay, there could be a lot of gamut of biological, psychological, social factors, and there are people who have dementia in one family member, but no one in the other, like subsequent generation have undergone dementia, experienced dementia. Okay, so when someone says hereditary or genetics, it does not mean that अगर किसी को एक को हो गया तो सबको हो जाएगा. Yes, the chances will increase. Okay, but what we need to do, as you said, that we need to work on modifiable factors, engaging the person with meaningful activities, gratitude, and work on medical factors like BP and diabetes, that we can manage to as much as possible. Yeah.
Absolutely, and I think
So I cannot give a black and white answer. Yeah.
And I think that's very important to remember, because often we hear people say that, my father had dementia or my mother had it. And does that mean that I will get it also? It's important to remember
I
that,
know.
yes, there is a risk, there is a genetic risk factor, but there are several modifiable things that you can do to modify this risk. And as you were mentioning, keeping yourself engaged, keeping yourself physically healthy are two of the most important things. So being mentally and physically fit and healthy, I think are really, really important things. There's one last question. I think this is the last question we'll be able to take for today, about what is vascular dementia. And Dr. Kirmani, I was wondering whether you'd like to throw some light on this, or we could, discuss this.
I think is something which is a core clinical neuropsychology thing, and my training is overall clinical psychology. So I think I may not be able to answer this question, how it is differentiated from other type of dementias.
So I think one of the things to remember, just to kind of respond to this very quickly, is that it is one of the forms of dementia that's related with, as you were mentioning, neurological conditions and such as stroke. So we often see this secondary to stroke. But I think. Dr. Kirmani, before we close the session today, I know that I was asking people who were participating about what they feel could be take homes that they can think about to improve their own mental health, as well as share with others to improve mental health and well-being of people perhaps in their family or their friends. But any last points or parting advice and tips that you would like to share with people who are listening in today?
Okay, one or two tips. Number one, and this is based on research, know your strength. Okay, and utilize your strength for yourself and for others. Number one. Number two, always try to develop a sense of gratitude for others. Okay, what people have done for you. Make a diary in which you write what we call gratitude letters. And when you do it, it is something very experiential. When we do it, when we experience it, you will realize the difference. The two things: knowing your strength, utilize the strength for yourself and others, and gratitude, journaling the gratitude things. I know it will change. You have to try just these two methods.
Right. And I think those are very, very clear,
Yeah.
very strong, simple tips that you have shared. Um, it's so important to at your look within yourself for your strengths, because everyone has certain strengths, and it's important to
Yeah.
identify those. It's important to look at those to feel good and to be aware of your own strengths. And it's important to also show gratitude, because when we show gratitude towards others, we begin to feel and experience good ourselves. And this, as Dr. Kirmani has been mentioning, that there's a lot of scientific research on this to show that these are very, very effective ways to improve our mental well-being. So with that, with those really crystal, those nuggets of nugget-sized tips for mental well-being, I think I'd like to thank Dr. Kimani for being with us today
Thanks a lot.
and sharing his knowledge and his experiences and addressing the questions that have come in from the participants. And I'd like to thank all the participants for joining.
Thank you.
Do share this, the tips that you have learned with others. Um, Thank you for listening in. Do remember to follow these tips yourself. And do continue to follow us on our social media pages. We regularly have webinars and meetings where we address various questions, talk about important issues and concerns that people may have. And it'll be great if you could join us again for these to spread more awareness about
Yeah.
mental health.
Very true. Thanks a lot. Thank you, Dr. Jayashree. Thank you. And all the best to all audience. Good luck for their mental health and health overall. Thank you.
Thank you. Thanks.
Welcome. Welcome.